You're watching Reality Check. Is India heading for an Omicron-fueled third wave? The path of the latest COVID variant around the world appears to be somewhat confusing. Omicron does appear to be behind a COVID surge in a clutch of countries. Look at America, 1.6 lakh daily cases now up 70%. The UK, 88,000 daily cases up 100%. Denmark, 9,300 cases up 140%. South Africa, 1,800 daily cases up 2,300%. This is a week-to-week comparison in terms of the data. And yet in South Africa itself, considered one of the epicenters of the Omicron wave, the virus does seem to be declining somewhat. Daily new cases have fallen week on week by just about 22% at the moment. In addition to that, three recent studies indicate that Omicron may be less of a threat than it seemed. Three studies from three different countries, England, South Africa, including. The infections result in milder illness, the studies found. The studies were conducted in Scotland, South Africa, and England. The Scotland study found that if the virus was Delta, there would be 3x more hospitalizations. South Africa study found that Omicron sufferers are 70 to 80% less likely to be hospitalized. And in England, the study found that the sufferers are 15 to 20% less likely to be hospitalized versus Delta. Now in India, while Omicron numbers are rising, currently we have about 300 cases, the overall curve of the pandemic hasn't significantly risen. This is the daily chart, the daily graph of the virus curve in India, and as we can see, it continues to remain flat even though individual states and cities are seeing spikes. Let me go across to Dr. Gagandeep Kang, who's professor at the Christian Medical College, Vellore, and a leading virologist. Great to always have you on NDTV, Dr. Kang. Dr. Kang, take us through, in a sense, your perspective on this journey of Omicron, which, as I mentioned, does seem to be throwing up confusing signals. Clearly highly transmissible, but in terms of virulence, we are seeing some signs that it may not be that bad. And again, in South Africa, the numbers falling. What do we make of all of it?
Well, I think the first thing that we have to make of all of this is that we are not today where we were last year. And that's because we've experienced a lot more infection than we had last year, and we've had a lot more vaccination than we've had last year. With every new infectious disease, it is our experience with the virus or with vaccines that determine how we respond to new versions of the same agent. What we are seeing with Omicron is essentially that we have a virus that seems very worrying because it has many more mutations than we have seen for any other variant.
Right.
It's clearly much more transmissible. But in terms of illness, what determines the fact that we are seeing milder disease? Is it really that the variant itself is milder, or is it that we have more experience of cousins of this particular variant? I think it's more likely to be the latter. And for me, this is the shape of things to come. We may occasionally have variants that will wind up breaking through not only the transmission barrier, becoming more transmissible, but also causing more severe disease. That doesn't seem to be happening for Omicron, which to me says vaccines are good news, that vaccines are a gift that keeps on giving, that being vaccinated is something that really does protect you very well. And prior infection also protects you really well against severe disease and death.
Okay. But in terms of Omicron in India, what do you make of it? Because the actual numbers of cases still seem very low. This could also, of course, be because we're not possibly testing at scale for the variant. But also overall, our COVID chart doesn't seem to be really spiking. Is that kind of misleading at this point? Could it kind of start to pick up down the line? What do we make of this?
So there are a couple of things to think about. The way we are testing is the same way that we were testing last year. And is that a testing that is fit for purpose, right? What we are doing is identifying people who are travelers, identifying people who are contacts, as well as people who are symptomatic, and then testing them. And we count case numbers. Right now, we are in a situation where case numbers are low. Will they increase in the future? Yes, I think that's very likely, because if nothing else, the one thing we know about Omicron is that it can infect people really, really easily. So if we test more, we will have more cases.
Okay.
Is that something for us to worry about? I think that's something that still remains to be determined. I would worry if I was in a location where there had not been a lot of infection before and where vaccination rates were low.
Right.
Where vaccination rates have been high or there have been a lot of cases before,
Sure.
I would worry a lot less.
Okay. Let me now ask you the question which is on everyone's minds on what governments should be doing in terms of guidance. We are seeing that the center has sent out advisories to states to say, listen, I think it's time to kind of, take steps, be alert. Some kind of restrictions on public gatherings and all of that seems to be already on the cards. At the same time, worryingly, and we'll put that video on screen, you are seeing, the election season, political parties going out and holding huge rallies as well, which is very, very confusing. That's like serious cognitive dissonance there. What's the right path to take at this point?
My advice to everybody is get vaccinated. Make sure that you have both doses of vaccine. And if you are in a high-risk group, which is the elderly or people with comorbidities, then those are the people that need to be protected from infection and protected from disease. Protection from infection, which is essentially transmission, becomes a little bit more of a worry with Omicron than with other variants, because this one spreads more easily. So if you have people in your families that need what is called cocooning, protection, then that's what we should be aiming for.
And in terms
push
of
vaccination.
And in terms of lockdowns, restrictions, I mean, if not overall lockdowns, is that something that avoid these? Should it be done, not done? You're smiling.
I don't think lockdowns serve any purpose.
Okay.
I don't think that adds value to public health. It doesn't add value to the economy. I don't think that lockdowns are needed. What really is needed is vaccinating people and protecting the vulnerable.
Okay, and last quick question on boosters, because India still seems to be thinking about whether to go ahead for boosters or not. There's still a large swath of the population that still hasn't got the first dose. Your thoughts on that?
Show me the data.
Show me the
data. That
data.
shows that vaccines are where is the data that shows that vaccines are no longer protecting against severe disease and death?
Oh, no. I'm talking about booster shots, that
Exactly.
that vaccines aren't effective.
You make a booster.
Right.
Why do you decide to give people boosters? You give people boosters when vaccines are not working.
Right.
Where is the data that shows that vaccines are not working?
Okay. There is some research showing that efficacy percentages or rates fall for the existing vaccines over time?
Antibodies fall, and certainly protection against severe disease and mortality for Covishield equivalent vaccines such as AstraZeneca have been shown to decrease in the UK. Where is the data in India? Where in India you have had people who have been infected with the Delta strain and then vaccinated, right?
Okay.
The UK did not have the experience of infection and disease that we had. So to take data directly from the UK and say that this applies to India, I think is a fallacy. I think we need our own data based on which we need to make decisions.
Okay.
And we don't have that data.
All right. Okay, fair point, Dr. Kang. Great to have you on as always. Thanks very much indeed for joining us. Thanks very much. Okay, let's go straight across now to Dr. Ashish Jha, Dean, Brown University School of Public Health, who's emerged as one of the foremost voices during this time. Again, great to have you on. Dr. Jha, let's just now understand from you, because each country seems to be going through its own journey. America, we're seeing a huge surge. I think you tweeted, correct me if I'm wrong, what is it now, almost 30 to 40% of all cases in America are now Omicron? Is that right, or is the figure even higher?
The figure is even higher. It's probably about 70 or 80% of all cases are now Omicron. That's just a 3 out of 4, 75%.
3 out of 4, right. Sorry, not 30, 40%. Yeah, so that's
basically,
yes,
it's everybody. It's almost all infections. There's a small number of Delta still, but mostly it's Omicron now in the United States.
And what is that telling us, Dr. Jha, about the way the virus is spreading? And again, just talking about America, because you get these conflicting reports from different parts of the world. South Africa, it does appear to be slightly tapering off, but in America, it's roaring.
Yeah, so America's about 2 weeks behind the UK, I think, and about 4 weeks behind South Africa. And every country, first of all, will have a bit of a different pattern, because every country has a different mix of vaccinated, previously infected, as well as vulnerable people. So you're going to see different patterns in different countries. UK is still rising very, very rapidly, and I think US is just accelerating. You are going to see US continue to accelerate, I suspect, for another 3 or 4 weeks before we begin to taper off.
Right. And are you seeing in the US now, because it's been, so fraught and so polarized in terms of how people are actually approaching this virus and in terms of the seriousness of it, is that in some ways contributing to this, or are people and governments and guidances, are they wising up?
Yeah, unfortunately, the political polarization in the United States is very much hurting us. There really are two sets of reactions that are happening, and neither of them is wise. One is, of course, the group that says the pandemic is over, we don't care about Omicron, and we will do everything with no restrictions, no changes in our behavior. That's not very wise. There's also another group that is so scared right now and looks at this and says, this is like the beginning of the pandemic, it's terrible, and we all have to lock down everything. Neither of them is the right answer, of course. The right answer is, we're not in the beginning of the pandemic. We have very large proportion of the population vaccinated. We have lots of people who are boosted and protected. We can go on, but we must put in some sensible public health measures to make sure that the infections don't get completely out of control.
Okay. And I saw that you've also been tweeting about some of those, which is, again, just sticking to the basics, right? Like wear masks, get vaccinated, so on.
Yeah, there's nothing magical about Omicron. It's just, it's the same virus. So the tools that we have for Delta, the one that we had for the original strain from Wuhan, it's the same virus, same tools. So avoid large indoor gatherings. When you're in crowds, wear a mask. Get vaccinated. If you're elderly, I do think people should get boosted. And just avoid those sort of very, very high risk things. And we will get through the Omicron wave as well.
And in terms of the evidence that boosters do help, we just had Dr. Kang on, who said, in India, there's no clarity on that. But are you picking up differently in the States?
Yeah, here's how I would think about it. I saw that part from Dr. Kang, and here's sort of my mental model. I mean, you don't have to study everything in every single country and wait until the country's data comes in. So my mental model on boosters, which is the data that we're seeing from many, many places around the world, is if you have been previously infected and then have gotten 2 shots, that's probably as good as having had a booster. But if you've not been previously infected and have gotten 2 shots, and if you're a high-risk person, older person with chronic disease, I really do think you need a booster. I don't think we need to prove it in India. We've shown it in the UK. We've shown it in South Africa. We've shown it in America.
Right.
The data is the data.
Okay. And last question. This is perhaps not a very fair question, but I guess what people are looking at this now and looking at, alpha, delta, omicron, is that when does this end? Is this now a kind of endemic thing?
Yeah, it is an endemic thing. So here's how I would think about it if if I were you. This virus is going to be around forever. It's going to be around for a very long time. That's not necessarily a problem, because what is happening with each wave and with vaccinations, we are building up more and more immunity to this virus. And so will there be another variant? There may very well be another variant.
Right.
Might it cause a spike in cases? It might. But the question is, will it cause people to get sick? Will it cause people to be hospitalized? Will it cause people to die?
Sure.
That will get better and better over time.
Okay. Well, fingers crossed on that. But great to have you on, Dr. Jha. Thanks so much for joining us.
Thank you.
Okay, the focus, of course, on South Africa very much. And I had Dr. Angelique Coetzee, who's the chairperson of the South African Medical Association, just a short while ago, and began by asking her about exactly what's going on with the journey of the virus in South Africa, where it does appear to be petering off. Joining me, Dr. Angelique Coetzee, chairperson of the South African Medical Association. Thank you very much indeed. Always great to have you back on NDTV. Dr. Coetzee, obviously with the world's eyes very much on South Africa in terms of tracing the trajectory of Omicron, what do we see now? What is the latest data or information coming out of South Africa where it appears that actually the caseload does seem to be falling off?
Yeah, thank you. Thank you for asking. It's always a pleasure to be on your show as well. So what we have seen this past week is that although our infectivity rate is more or less between 29 and 30%, the cases, that's the infectivity rate. It's not what we are seeing in the surgeries or at the hospital level. So again, most of these patients have mild symptoms, and those with severe symptoms will go straight into a hospital. The majority of the community is easily treatable with the symptoms that they present at the coalface level. The hospitalization, if we look at our stats, it's fairly stable again this last week and a half, around about between 500 and 600 patients across 666 health facilities in South Africa. So, if you do the maths, it's nearly one per facility, although we know that some facilities will have more than one patient and others will have zero. So that's very consistent. If you look at our death rate, yesterday, our figures were also not very high. NICD yesterday released a statement where they said of the 309 cases that we're seeing, 269 were unvaccinated. That's about 87%. And we're now talking about cases in ICU and deaths who then perished in the end of the day, of which 40 were fully vaccinated. So, and then again, if you look at yesterday's normal death rate, was 35, and the day before 105, and the day before that it was also on the lower side, 31. So it's not a lot of patients that get severe ill, although I need to stress, for those that's unvaccinated with the severity of the disease, they're extremely sick.
Right.
But the majority of patients doesn't need oxygen, nothing of that.
Okay, so that is sort of cautiously optimistic news coming out of South Africa. And what we also heard was, because you were talking about like the kind of national data, but even in Gauteng province, which was supposed to be one of the kind of epicenters of the virus, even there cases have started to drop? Yeah,
we passed the wave in Gauteng. It drops dramatically. I think it was between 3,000 and 4,000 yesterday. It came down significantly. We're quite confident that we are over the Gauteng wave. However, when the school starts in January, we will have we need to see what's going to happen. We might have a slight increase, but I don't think it's going to make a huge difference.
Okay. That is, of course, interesting. What is that really telling us then, Dr. Coetzee, about Omicron. A couple of studies came out recently. You must have seen Scotland, England and South Africa. The South African study found Omicron sufferers 70 to 80% less likely to be hospitalized. Is that, I mean, broadly, what are you picking up, and what are we then learning about the virus based on all these numbers coming out of South Africa, these falling numbers?
Thank you so much for that. So if I look at my, for my own stats, my own data, my own surgery, I have now treated 106 Omicron patients myself, and only one had been admitted, and that was 2 days ago. That was a 51-year-old male, 150 kilograms, diabetes, uncontrolled with hypertension. So that was the first patient I have seen with the Omicron that got pneumonia. We admitted him for pneumonia yesterday. So again, if we look at the majority of cases, it fits in. I would even say more or less 90% of people it's got mild disease. But I need to stress, I think there's a misconception if we say mild disease that you don't have to worry. So what you need to do is you need to understand mild disease means I can treat you out of hospital. We don't need a lot of medication, and I can get you better. It doesn't mean you're not sick. And that is so important that to stress to patients, please, if you have the symptoms, and remember the symptoms, you have to understand the symptoms. It's that body ache and pain, that tiredness when you wake up this morning, and the headache. So go and see your healthcare practitioner. Get just examined, especially if you're old. Get it and make sure you're okay. Don't just leave it.
Great to always hear from you, Dr. Coetzee, and thank you so much indeed for joining us. Thanks very much.
Thank you so much. Speak again.